Very good evening to you all, respected doctors. It is indeed my pleasure and privilege to welcome you all on behalf of IPCA for this very interesting webinar on COVID-19 and post-COVID-19 lockdown, challenges for people living with diabetes and hypertension. For this webinar, we have very eminent faculties from Central, North and South India. We have Dr. Ashish Dengra sir from Jabalpur, Dr. Amit Gupta sir from Delhi, and Dr. Faraz Farista sir from Hyderabad. Dr. Faraz sir will be moderating today's session. It's my honor to introduce our moderator, Dr. Faraz Farista sir, to you. Faraz sir's PPT, please. Can I have the PPT of Dr. Faraz sir? Dr. Faraz Farista sir is MD Medicine, MMMC USA and PGD from UK. He is the Director of FS Endocrine and Diabetes Center. Sir is an Associate Professor in Medicity Institute of Medical Sciences and sir is a consultant at Tambe Hospital, Hyderabad. I request Dr. Faraz sir to initiate the proceedings of this webinar. Faraz sir, please.
Thank you so much for the warm introduction, and then I welcome you all for joining us. I think, yes, it's no more the lockdown. Now we are getting back to the routine. So now I think will be the real challenges which we will face, what our patients will face, and then you will see my friend is already facing it. Dr. Ashish is already facing it. So this is what I think all of us will have to look around. So it is my pleasure to introduce my dear friend, Dr. Ashish Dengra. He's a consultant physician and the diabetologist, and he's the director of Mahi Diabetes Thyroid Care and Research Center. So without taking much of time, Ashish will be speaking on COVID-19 and post-COVID-19 challenges for the diabetic patients. Over to you, Ashish.
Thank you, Faraz, and welcome all. We are here to discuss an important topic, that what diabetic patients are facing in this lockdown and post-lockdown period, and how they should manage their diabetes at home, or how precautionary they can go out to their doctors and get their diabetes controlled. So in the coming few minutes of journey, we will be going through the challenges for diabetic patients during COVID-19. Next. We all know that the growing pandemic of COVID-19, the world is currently suffering from the outbreak of this disease and affected more than 55 lakh people across the world. And there is increased risk of infection and worse outcome with increased mortality day by day. And this has led to strict measures like isolation and lockdown in India, and which has posed a problem for patients with diabetes, that how they should manage without the doctors and paramedical staff. Let's see. Next. So challenges for diabetic patient during lockdown: the regular blood sugar checkups are not possible, and the lack of access to diabetes specialists and educators, especially in the rural areas. All of these leads to poor diabetic control. So the patients are at home, they were not able to do their blood glucose levels, and the lack of specialists and educators in rural areas, all these led to the poor glycemic control in this period. Next. Changes, back. One slide back. Yeah, next. So the challenges for diabetic patients during lockdown period we have discussed. Next slide. Analyzing the blood sugar fluctuations and further dose adjustments were not possible for patients, and analyzing patients' medical adherence, control of other risk factors like hypertension was poor in this period, and so they are more prone for complications of diabetes and hypertension during this period. Next. Now, ways to overcome the challenges in diabetes care during lockdown. How we should overcome these things? We are having now technology, digital world, and by the use of self-monitoring of blood glucose and use of technology-based intervention, we can overcome these challenges in diabetes care during lockdown. And how we will do this, we will see in the coming few slides. Next. The self-monitoring of blood glucose, we all know, we can promote this thing by doing the blood glucose monitoring at home through the glucometer, and they will help the patient to control their blood glucose levels. They will check whether the patient is having glucose variability or not, and the severe hypoglycemia can be prevented by doing the SMBG. Next. The ADA 2020 recommendation have also proven that self-monitoring of blood glucose is very important, especially in type 1 diabetic patients. They have promoted to do it before meals, snacks, at bedtime, prior to exercise, and when they suspect the low blood glucose levels, the patient should do the glucose monitoring. And for patients on non-insulin therapies, the SMBG should be done after altering the diet, physical activity, and when the medications are to be changed, and at the risk of hypoglycemia, they should check the glucose levels. Next. The CGM, that is continuous glucose monitoring, it is a very good tool. It measures glucose levels. Typically, interstitial glucose is monitored, and up-to-date analysis of every 1 to 5 minutes is given. It provides both retrospective as well as real-time information to detect the hypo or hyper excursions, that is the variability is checked. It predicts the impending hypoglycemia. Wide fluctuation in glucose levels can be seen, and the glycemic variability can be checked in the patient when his sugars are going very high or very low. And it helps the physician for adjustment of medication therapy to achieve the glycemic control properly. Next. So what gadgets are available for CGM? The ADA 2020 have shown that there is real-time monitoring, intermittent scanning, and the blinded CGM and unblinded CGM. The real-time, in which we can see the sugar levels every 5 to 10 minutes. Intermittent, when the CGM system that measures the glucose levels continuously, but only display glucose levels when swiped by a reader or a smartphone. So the patient is having the sensor on his arm, and the reader will read the sugar reports. And the blinded one, again, the CGM device that measures the glucose levels are not displayed to the patient, and the monitor is seen, the reader is with the doctor, and he sees the reading when the patient comes to his clinic. Now in the US or European countries, the unblinded CGM is also available, in which the patient can directly see his reports anytime. So it is unblinded CGM. So the progress and the new CGM machines are coming day by day, and it is helping the patients to have their glucose control properly without glucose variability. Next. So advantages, I have told you, it will keep the patient under good control, especially the type 1 diabetics. It will prevent the hypoglycemic episodes. It will prevent the glycemic variability. All the available gadgets like real-time, intermittent, blinded, all will help the patient to have good glucose control, especially in type 1 diabetic patients, with prevention of hypoglycemia. Next. The cloud-connected glucose monitoring system is also available now. The cloud-based digital glucometer, it will automatically check the sugar reports, and it is transferred to the cloud-based platform. And the cloud-based CGM is also available, which will track the readings every 5 to 15 minutes, and you can see through the cloud-based CGM. Next. The role of technology during lockdown is very important, because the use of telemedicine for remote consultation, the use of mobile health applications, electronic medical records, EMR, all are now used during the lockdown and post-lockdown. We are using all these technologies to control the patients at home, or even when they go from the clinic, they don't have to come again and again for telling their sugar reports, for insulin dosage correction, and hypoglycemia management can also be done now at home by proper monitoring. Next. So how the technology is benefiting during the diabetes care? We all know it has improved outcome and minimized the complication during this lockdown period. Telemedicine can break the geographical barrier and allow more doctor-patient interaction nowadays. The EMR, which is available, allows for data storage and quick reference for past records. The mobile applications are now available for better tracking of important data from patient on the daily basis. They can send their glucose reports, they can send their insulin dosages, so the doctor can modify the dosages according to the sugar reports sent on the mobile. The telemedicine, the mobile health and the mobile applications, it may be useful for and the overall complications and modifying risk factors in patients with type 2 diabetes. So overall, the technology is helping us for benefit of patients and preventing it from developing the infections like COVID infections. They don't have to come out from their home. So how technology is benefiting, I have told you. Next. How telehealth works in diabetes care. You have to be at home. The service provider will tell you how to do the monitoring at home, how to send the data, whether through SMS or through their targeted online server. They will tell you in what software. They will send you the links. On that link, you can send their your reports, and then you will get the proper guidance through the telehealth professionals. Next. This is the system, how it works. You can email the doctor, you can do the messaging system, you tell your problem to your doctor. Doctor will ask some of your basic old records, you send him and they will analyze, and then the new records will be seen, your sugar reports will be seen, your dosages will be adjusted, and new prescription is sent either through the email or through the telemedicine or through software, whatever the doctor is using. Next. So the advantages of the virtual patient physician appointments, diabetes education, behavior therapy, diabetic retinopathy screening, all we can do now through telemedicine. And the advantages, we know that virtual patient physician appointment can be given. Patient can call the patient, patient can call the doctor, he can take online video consultation. Diabetes educators can give education on phone. Behavioral therapy and counseling can be given on the phone, and diabetic retinopathy screening, and the pictures can be sent to the ophthalmologist. Within few seconds, we can get the records or reports of the retinopathy, whether the patient is having any problem or not. So the advantages are n number of advantages of telemedicine in diabetes care are now available. Next. Electronic medical record, how it helps. If we are having the EMR, we have all the record of patient, we have all the sugar reports of patients. This improves the assessment of glucose variability, which helps in and the hyper can be prevented by keeping the good EMR. If the patient is with us already on the EMR record, now in the lockdown period, we can give him better support by being patient at home and we also at home. Next. The M-Health, that is mobile health, it uses smartphones, mobile applications and wearable devices. It empowers people with diabetes to self-monitor blood glucose or other variables when needed, like blood pressure, weight and diet. It helps to achieve preset care targets. It provides immediate feedback between patient and physicians with respect to disease progress and medication adherence. So mobile health, through the smartphone, we are dealing n number of patients during this lockdown period, and it has helped a lot. The patient can send their sugar reports, they can send their weight, blood pressure, and they can get controlled without coming to doctor during this lockdown period. Next. The type of M-Health, by text messages or SMS, by diabetes smartphone applications. Many applications are available online, and we can track the glucose records by fine fitness trackers. CGM can be used wirelessly technologies to update patient data. So many facilities are now available on mobile health applications. Next. These are the components of M-Health diabetes management. We can have the SMS facility, we can have the video calling, we can have the direct chatting with the patient. So, and many facilities are now available, which will track the patient, will keep the track of the diet, exercise, everything can be taken care by M-Health. Next. Advantages, again, it will remind the patient about the medications. It can remind the patient about the physical activity. The diabetes smartphone application are available which take care of their HbA1c records, which will keep the track of their sugar reports, and blood glucose device syncing to smartphone will automatically send the sugar reports to their cloud-based systems. So everything can be taken care by mHealth now. Next. The social media, we all know, it enables peer-to-peer communication through a multitude of platforms. It helps diabetes patients in self-management of condition with lifestyle changes. The social media platforms like patient blogs, podcast is now very important platform, online diabetes forums through which patient can post questions and comments in public settings for peer feedback. The general social media platforms such as Facebook or Twitter, information sharing sites that post diabetes news and advice. The social media is also helping the patients of diabetes to keep their track under record. But my dear friends, through social media, we are getting some false messages also that you take some Ayurvedic medicine, you take some kala, your sugar will be well controlled. So social media messages should be confirmed through your doctor, and then only you follow these messages. Next. So to summarize in nutshell, what we have seen in the lockdown period, what we have learned, that corona is growing like a pandemic. People with diabetes are at increased risk of complication, especially during this period. Adherence to healthy diet and lifestyle and access to healthcare facilities limited during lockdown, and the self-isolation and quarantine is the main target previously. So by self-monitoring of glucose, which is usually to monitor possible risk of hypos or hyper, will be lessened by self-monitoring, and measures such as telemedicine, mHealth, EMR, it should be adopted to keep watch on glycemic control, should be kept on the control on the hypoglycemic risk, medication dose adjustment in current scenario. So what message we want to give through this lecture, that by doing the telemedicine, mHealth, social media, you can take care of your patients even in this COVID scenario. Only the very important and very emergent patient can be called on in the clinics. Otherwise, maximum patients we have dealt during this lockdown period through the telemedicine, through the mobile health apps, and they have worked wonders. Patients don't have to come to the clinics, and we have developed much more closeness to our patients while we were talking with them during this lockdown period on phone. So I hope during this corona pandemic we can fight. During this period at home also, the patient can get their treatment 100% through their doctor's communication. And I salute to all the doctors who have given their 100% during the corona pandemic also. So in nutshell, you don't have to panic. You can get your advice at home also. And if there is any emergency, then you come to the clinics of doctors. Even during the post-lockdown period, we are getting the fourth lockdown, and there is opening of all the markets. Again, the rise of corona will go up. So you have to keep the social distancing, mask and sanitizer. SMS, social distancing, S, M for mask, S for sanitization. So you have to follow the SMS formula and you will be away from corona. Thank you. Thanks for patient hearing.
Thank you, Dr. Ashish. It was indeed a lovely presentation, and then I loved your line SMS. I would just add on. I would just add on to that. Probably you need to avoid men, and then your men is mouth, your eyes, and nose. So that is the T zone, which as healthcare professionals we have to be very, very careful, because at the same time when you are examining your patients, so be very, very careful on that. And then yes, as Ashish has said, that now artificial intelligence is going to change the way how we are going to treat our patient, how we are going to look at our next patients. So let us go to our next speaker for the day. It gives me immense pleasure to invite again one of my very good friends, Dr. Amit Kumar Gupta. He's Director of Promix Plus Healthcare Private Limited, Director of Center for Diabetes Care, Greater Noida, Senior Consultant, Promix Multispecialty Hospital, Greater Noida. He's been awarded with n number of awards, and then I think if I start now and then the day would not be enough to count every one of them. So his topic would be on, again, COVID-19 and post-19 challenges for the hypertensive patients. So it is not only a challenge for diabetes patients, but Dr. Ashish said, now Dr. Amit would talk us on the challenges faced by hypertensive patients. So over to you, Dr. Amit.
Thank you, Dr. Faraz, for the very kind introduction. And Dr. Ashish has already set up the stage by discussing the management of type 2 diabetes during the COVID-19 pandemic, during the lockdown and the post-lockdown period. And I will be deliberating on management of hypertension in the post-lockdown period. I will request Mr. Akil to upload the slides. Meanwhile, I would like to share that by heart, we know that diabetes has always been an immunosuppressive state, and the risk factor for coronavirus disease is the complication risk is actually higher in patients with diabetes. But you would be surprised to know that the hypertensive patients are at more risk of developing complications from corona, and there are many studies which have already shown that uncontrolled blood pressure or hypertension can lead to fatal complications in a patient who has been infected with the COVID-19. So please show the next slide. So as already discussed, that more than 60 lakh people have already been impacted by the coronavirus infection all across the world. And we are learning to see paradigm changes. We are seeing a lot of changes which are happening in the medical world, as well as the way in which we see our patients. For example, the OPDs are closed, only emergency services are available. Everyone is trying to keep the virus in check. Then during this difficult time, how do we monitor blood pressure? What is the relevance of monitoring blood pressure at home? And how do we treat our patients? Next slide. So these are the certain challenges which are being faced by the patients who have hypertension. That regular blood pressure check at clinics and hospital is not possible, and the patient too like to avoid the visits at clinical settings. Irregular monitoring of the blood pressure may again increase the risk of complications from the hypertension, and the proper diagnosis of hypertension is again remains a challenge during the period of the lockdown. Next slide. So first challenge is that regular BP checkup, since it is not possible due to the lockdown, then how do we monitor blood pressure at home? And what is the importance of home blood pressure monitoring? Next slide. So if you see that self-monitoring of blood pressure is at home is actually a very, very important tool which has been advocated by almost all the societies, and it has been seen time and again that the home blood pressure can actually give more reliable information than the office blood pressure or the clinical blood pressure which we take in our clinical settings, because most of the time the patient is comfortable at home and the white coat effect has been eliminated at most of the time. So even the European Society of Cardiology suggests that for the diagnosis and management of the hypertension during this pandemic, the home blood pressure monitoring is a very, very important tool. It is a validated tool, and we can confidently use this tool to believe the blood pressure reportings which have been sent to us by our patients through their home blood pressure monitors. Next slide. So if we compare the office blood pressure in comparison to the home blood pressure, the studies, there are studies and data which have shown that home blood pressure gives more blood pressure readings which are reproducible, and it is more closely related to the hypertension mediated organ damage, particularly the left ventricular hypertrophy. So it is a better predictor of cardiovascular morbidity and mortality than the blood pressure which we measure in our office. And the patient self-monitoring may again have certain advantages, like it motivates the patient to be more adherent to the medications. Also, the blood pressure control becomes more important in the with the education as well as the counseling. Blood pressure can be monitored through the telemonitoring or the smartphone applications. There are many tools which are available, and it offers additional advantages such as the blood pressure records. We can learn about the trends of the blood pressure, which is not possible to see in the clinic. So BP data in a digital diary and when it is transmitted to the clinician, like the continuous glucose monitor which we see, which we use for our diabetic patients, sometimes monitoring blood pressure at different point of time can actually give us the variation in the blood pressure as well. Next slide. So there are certain advantages and some disadvantages as well. Advantages are that it can eliminate white coat hypertension as well as the masked hypertension. The BP instruments which can be used at home, they are widely available. Many patients with hypertension and diabetes, they already have it with them, and if they don't have them, they are easily available at all the medical shops and the online as well. Measurement in home setting, patient is more relaxed, that is why the white coat hypertension effect is eliminated, and the patient actual engagement in the process of the BP measurement can actually motivate the patient as well. So previous slide. Disadvantages, previous slide please. So disadvantages are that sometimes if a patient is not very well educated about the process of how to take the blood pressure at home, then sometimes the readings can be errant, and it is not possible to take the nocturnal readings because the patient has to get up to take the nocturnal readings. For that, HBPM is the better tool to understand that. What I would like to say that if a new patient is buying an instrument, then we can always share the videos with our patients and that how to record the blood pressure at home. Next slide. So self-monitoring of BP is also recommended by the ACC as well as AHA in 2017 guidelines. Next slide. So another important challenge is that does the irregular monitoring of blood pressure may increase risk of complications or mortality? Let us see what happens to our patients. Next slide. So as we all know that hypertension can lead to end organ damage, and the common scenario which are clinically seen are ventricular hypertrophy, heart failure, it accelerates atherosclerosis, there is increased risk of cerebrovascular accidents and stroke, renal failure as well as the retinopathy. So these are the things which are happening, and considering the anxiety which our patients are facing during the times of COVID-19, blood pressure fluctuations are likely to be there because of the anxiety factor also checks in. Next slide. So as we know, many studies have already shown that with every 20 millimeter of mercury rise in systolic and 10 millimeter of mercury rise in diastolic blood pressure, the risk of CV mortality doubles. So a blood pressure of 175 by 105 carries 8 times more risk of dying from a cardiovascular event. So we have to keep that in our mind that uncontrolled blood pressure is has direct link with the cardiovascular mortality and morbidity. Next slide. So as we see, these are the mechanisms, these are the different stages of established hypertension and the pre-hypertension, and the clinical scenario which we can see has already been discussed. Like patient may have asymptomatic phase and symptoms comes when there is an end organ damage, and ultimately the organ failure may happen, and this can push the patient towards the death as well. Next slide. Another important challenge is that sometimes it is diagnosis of the hypertension is difficult, as the patient may not be coming regularly to the clinic, and further the office BP recordings are less reliable. So what do we do now? Next slide. So whenever a patient is visiting to us, visits us in our clinic, these are certain key parameters which we would like to see. Physical examination gives some important information like the weight, the BMI, and the waist circumference, which are important parameters. Then we have to look for the signs of the organ damage, like for example, what is the neurological status of the patient, what is the cognitive state. But a fundus examination is again very important, not only for diabetic patient, it is equally important for patients with hypertension, because these patients may have hypertensive retinopathy. So it is important to auscultate the heart as well as to look for the carotid artery bruise. Also, we have to see whether we have to palpate all the peripheral arteries to look for any signs of peripheral vascular disease. And at least we have to check the blood pressure in both the arms to identify which arm is to be used for the subsequent readings whenever the patient visits us next. It is equally important to identify whether the patient is having a primary hypertension or it is a secondary hypertension. So there are certain clues which we have if we are able to identify clinically, then it pinpoints towards the secondary hypertension. For example, if you find some Cafole patches which may be seen in patients with neurofibromatosis, it may be pheochromocytoma. For example, if there is a kidney palpation for sign of renal enlargement in patients with polycystic kidney disease, cardiac auscultation, looking for the murmurs as well as bruit is equally important. We have to feel for all the pulses whether they are equal or not. So this is all the clinical examination. When the patient visits us to our clinics or the hospital, we are all being told in our medical colleges that this is how we should proceed with the case of hypertension. And to keep in our mind, we have to look for the some other endocrine causes like Cushing disease as well as thyroid disorders in patients with hypertension. Next, the important point is that with the limitation of physical visit to the clinics, it is difficult to look into all this scenario. So whenever we are seeing a new patient with hypertension through teleconsultation or the telemedicine, we have to bear all that in mind. And whenever there is an opportunity to see the patient physically, the patient should be advised to come to the hospital as soon as the things gets normal. This is a routine workup which we all know has to be done in all the patients with hypertension. That includes blood counts, evaluation for the blood sugar, the cholesterol levels, the electrolytes, as well as the kidney function test, the estimation of the eGFR, and urine examination, and sometime a 12-lead ECG is equally important to look for left ventricular hypertrophy. Next slide. So this has already been discussed. Sometime an extended investigation may be required in the form of echocardiogram and other tests. Next slide. So sometimes these patients with hypertension may have some other comorbidities as well as associated factors, which can actually lead to the worsening of the conditions. So let us see. Next slide. As we all know, whenever it comes to CVD risk factors, there are some risk factors which are modifiable and there are some which cannot be modified. For example, if a patient is smoker, we should strictly discourage smoking, as well as patients with diabetes mellitus, they should be encouraged to have a good control of blood sugar. If the cholesterol levels are high, they should be put on statins to control the cholesterol levels. The weight should be managed adequately, and the patient should be motivated to do or to engage at least in some kind of physical activity. An unhealthy diet pattern may be addressed by giving patient time to shift to more healthy patterns of the diet. There are certain things which cannot be changed. For example, the age, the family history, the sex, and the socioeconomic status can sometimes be a problem for the patient as well. But there can be other comorbidities like chronic kidney disease and obstructive sleep apnea. So when ESC guidance 2020 says that whenever we are consulting these patients through video conference or telephonic consultations, this may require urgent follow-up until the routine clinical attendance resumes. So we have to keep in mind that clinical visits are equally important because there can be multivariable factors which can be responsible for hypertension. It may not be primary hypertension, it can be secondary hypertension, and it needs complete evaluation and risk assessment for the patient. So it is important to have a follow-up visit. Next slide. Next slide. So these are the common comorbidities which we have already discussed. Next slide. So how do we manage hypertension in the COVID-19 context? So continue treatment with antihypertensive medications as per the guidelines. Whatever guidelines you are following, you stick to those guidelines and continue with all the medications. There has been a constant talk, should we stop ACE inhibitors or ARBs in patients who are having diabetes, or even in non-diabetic patients, should we shift them to an alternate medication? There is no data as of now to suggest that the patients who are on ACE inhibitors or ARB, they should be stopped. So they should not be stopped in patients with hypertension and diabetes. We shall continue with them unless and until there are some compelling factors for which we have to change them. Monitor blood pressure at home as far as possible. Sometimes the home blood pressure readings are equally useful and they can help us in monitoring our patients. And we can use a video consultation or the e-consultation platform wherever it is required. Next slide. So I will be briefly reviewing some telemedicine practice guidelines which have been released by our societies as well as the Government of India. Next slide. So it is important to understand the flow. For right now, there is a patient can contact you through a text, through audio or the video consultation. Through this, you can identify the patient, and the patient, when the patient initiates the contact, then it is implied that the consent is already there. Then when the patient is consulting us on a telemedicine platform, it is our duty to assess whether the patient is in need of a emergency care or it is a routine care. If the patient needs emergency care, then it is important to advise immediate measures, whatever is doable at home, and then you ask the patient to take referral as appropriate. If suppose a patient is having chest pain and by confusion it has come to a telemedicine platform, it is our duty to tell the patient, if you have aspirin, take it at home and then rush to the hospital, get an ECG done and follow the guidelines and the protocol. So we have to guide the patient appropriately. All the time it is not necessary for us to generate a prescription. If we find that there is no emergency care is needed and the patient needs a detailed evaluation, so whatever detail we can get through the telemedicine platform, we should take. For example, take as much as history you can, take whatever the records are available, past records, go through them. Whatever additional information is required, don't hesitate in asking that information. And if you wish, if the patient is contacting you through text and you believe that the text is not going to help, the audio is not going to help, you want a video consultation, you can always ask the patient to switch the platform. In case if you are able to manage, you find that this problem can be managed through the telemedicine, then we can provide the management through three tools. We can give education to the patient, the counseling can be done, and sometimes we can prescribe some medications as well to our patients in case whatever the medicines which are listed in the list provided to us, we can use those medications. If the patient is not appropriate, again, we have to refer the patient to the appropriate platform. Next slide. So same thing has to be noted whenever we are having a follow-up consultation. So whenever the patient is being followed up, we can ask for certain tests which can be done. These tests can be booked through online platforms and home collection is always possible. And after reviewing the results, we can again review our medications and the medicine can be prescribed as per the guidelines. Next slide. There are various apps and tools which all of you are aware by now, because there are multitudes of apps, video platforms which are being provided for the telemedicine consultation. Next slide. So it is important to understand that the coronavirus has impacted the world and a lot of things are changing in the world, and this pandemic has actually changed the landscape of the medicine. We are not going to practice the medicine the same way which we used to practice pre-corona era. We have to change the gears now. We have to be ready for this all kinds of stuff like telemedicine, the technology, because they are going to be essential part of our life. Hypertensive patients, along with patients with diabetes, they can face multitudes of challenges during this tough period. We shall encourage our patients to monitor blood pressure at home. If there is any challenge they face, we shall be able to sort it out through a telemedicine consult or the appropriate visit at the hospital in a planned way. Next slide. With this, I would like to thank you, and I would like to thank Dr. Ashish Dengra and Dr. Faraz Farista for bringing me on to this platform along with the team. Thank you.
Thank you so much, Dr. Amit. Indeed, I think you have rightly pointed out the most important point that, yes, we're always worried about diabetes. We're not saying here that diabetes is not important, but definitely hypertension is more important when it comes to the cardiovascular disease. And as you rightly highlighted the points about monitoring of the home monitoring of the blood pressure, the advantages, the disadvantages, I think very well said, done. And I think, yes, definitely AI is going to change the way we are going to treat our patients in future. One way which I think probably before going on to the questions, I would just place one question each for both of you. Maybe you can answer the same. What we have, since probably we have got the unlocked version faster at Hyderabad, from which you people do not have. So, but what we internally we were discussing that probably the new patients which are coming to us, the first time we see them, and then all the follow-ups, we're trying to get it online. So probably Dr. Amit, your views on that, and then Dr. Ashish can continue on the same.
You are right, Dr. Dr. Faraj, but what is happening is that the satisfaction level, whenever we are doing online consultation, the satisfaction level with the patient is not the same, because we have been groomed like that. Our medical practice has been like that. You have to visit physically, get yourself examined, spend some time with your doctor, and that brings a lot of comfort and sense of relief to the patient. It is the similar way since now all of you know that for last 2-3 months our children, they are all getting education through the online. But the fun of going to the school and getting educated at the school is totally different from what they achieve in online. So at many of the times they are not being able to interact with the teacher directly. They are not being able to interact with their peers. They're not able to understand many things. So same is the limitation with the telemedicine and the teleconsultation. That feel is not there. Probably for the timing we have to learn to live without that feel. That is a very, very important challenge, which I think over the period of time, both the doctors as well as the patients will understand and learn and move with that.
Yeah, I'll just share.
That the patients, they want to see us. They want to see our face, because as I want to share my 2-3 experiences in my clinic, because I am fully covered nowadays. So patient say that Doctor Saab ne to dekha hi nahi abhi tak. So they want to see your face and they will get relieved by seeing you. So I agree with Amit that they want to come to clinic and then only they can get relieved. They think like that.
But Ashish and Amit as well. See, now once we are there, and then see, it's 2 months that all of us have not seen many of the patients online. I am sure none of us have seen it more than 10 to 12 per day. With the regular OPDs, all of us had, and then we have a lot of patients which are waiting for us. And then with the guidelines, the social distancing and all, I'm not sure if we're going to see at least not more than 30 or 40 patients per day. So what about the rest? So I mean, now we need to start thinking about that as well. So that is what we thought, that probably when they are coming to us, that time we are seeing them, and then in the review, probably we can start asking the review patients to get the online consultation. What do you think?
We have to train them gradually that they can take telemedicine, the help of telemedicine in the 2nd, 3rd visits. That is good idea for us.
Yeah, it's good to. Yes, Dr. Ashish is right. Now what we are doing is that when a patient is coming to us after doing all the examination and whatever is required, we are asking that we will get your reports. They will be available online. You can access that through your apps which have been given to you. And once all the reports are available, the next time you don't need to visit us. We will just, we will have a video consultation with you. We will discuss all the topics, whatever issue is there. And you will get your medicine, and whatever is required, you can get it delivered at home. So this is a complete solution which we usually give it to them. And we do discourage them to come to hospital or the clinic again and again, simply for collecting the reports or giving the samples. For example, whenever the sample collection is required, we ask them to, you stay back at home, we will send somebody to collect the samples at home. And so what we are doing is that we are minimizing the number of visits. At the same time, patient has also this comfort that at least he has gone once and met the doctor. So this is there.
Thank you so much. So I have a few more questions which have come from the audience. So probably Ashish, you can take this. What percentage of diabetologists and general physicians have adopted this teletechnology? Do the uneducated patients accept this? I think you've already answered that. And what percentage? Very difficult, but still, if you want to take a try.
See, near about 30% patients are daily calling us on WhatsApp and they are messaging us. So even the village people are now learning how to send their reports to doctors and how to get the prescription on phone. So we have to encourage this in the coming future also. So 20 to 30% have already adopted it.
Okay. Dr. Amit, I think you already mentioned this in your talk, but since the question is there, I think probably you can just clear it as well. So it says, what is the best way to measure blood pressure? Is it the home blood pressure digital BP at clinic or the LED sphygmomanometer?
See, if you go and see the details, the patient is coming to the clinic, we have to record the blood pressure. If we follow all the guidelines as per the requirement of diagnosing the hypertension, I don't think many of us are going to meet those guidelines, because you have to measure the blood pressure when the patient is supine, patient has not gone for any kind of smoking, patient must be totally relaxed, must not be anxious, both the arms should be recorded. So there are many things which have to be complied when we record the blood pressure in our clinic. Most of the time in a busy practice, it is not possible to do that, and that kind of environment is also very difficult to provide. So what happens is that the digital blood pressure monitors now the digital blood pressure monitors are easily available, and most of these are validated tools. So in fact, the home blood pressure is actually much more reliable than the office blood pressure. Many a times it happens that the patient comes to us and the office reading is high. Then instead of taking the decision right away that your blood pressure is high and modifying the medication, we simply request them, if you have a blood pressure monitor at home, please go back home and record your blood pressure for so many days and send all the readings to us. So we have to compare with that also, because one single reading high in clinic or two single reading high in clinic doesn't make any sense, because there can be multiple factors which may be associated with that high reading. So I must suggest that home blood pressure reading is very important. We just have started one more study from the Indian Society of Hypertension, which Dr. Ashish is also a part of that. I will send you the details. You can also join us, in which we are encouraging all the healthcare providers and all the doctors to record their blood pressure for 3 days at home or their clinical settings or whatever, because we believe that these BP instruments are very good, and digitally taken, if you have taken your blood pressure digitally, then they can give a very good and accurate readings. In fact, the subjective error is much more when we are recording the blood pressure by using a stethoscope and sphygmomanometer or whatever the LED manometers are there. There are more chances of error.
Oh, lovely. So you have answered the next question as well, which was there. Yeah, Ashish, you were saying something.
Yeah, the BP readings, as he is saying, if we are taking 3 or 4 readings at home, then we can get more better results, because in clinic, we are seeing some patients are coming with blood pressure of 170 by 90, and after their reports, again, we take the BP, it comes to 140 by 80. So office readings may be high sometimes in some anxious patients. So that is better to do it at home also. So we should encourage like SMBG, the home blood glucose monitoring, like home blood pressure monitoring.
It is equally important.
This thing also.
Agreed. I think, yes, both of them is very important. Control of hypertension and diabetes. And then probably Dr. Amit, you can take this. So there is any specific measures you want to give to your hypertensive patients?
I think there are certain things which they have to keep in mind if it is simply because of hypertension or some COVID-19 related things. If we have to consider,
related, I think,
if, in the era of COVID-19, they have to be encouraged that they should be engaged in regular physical activity. They should lower their salt intake. They should not engage in too much salt intake. The oil intake has also to be reduced if they have diabetes, and control their blood sugar as well, and monitor their blood pressure. If it is high, then don't hesitate in seeking help of your treating doctor to intensify the treatment, because again there is a because that inertia should not be there from the patient side. It should be addressed by the healthcare professional if the blood pressure is high, because the medications are good enough to take care of the blood pressure nowadays.
Yeah, I think definitely both of us, even me and Ashish, would agree on the same. And then Ashish, if you can take this, it says they want to know what is the difference between a controlled diabetic, what is his risk, and an uncontrolled diabetes, what is his risk for getting a corona?
For getting corona?
Yes.
See,
I mean, I think, yeah, you can clear the air.
See, basically, any patient who is immunocompromised, he is at risk. So those who are uncontrolled, they will be at more risk of getting any infections, and they will have more complicated disease. Having uncontrolled diabetes for long period. Yeah, if the patient is
absolutely right.
Yeah,
Ashish, I interrupted you. Please go ahead.
So any patient who is uncontrolled will have more more chances of getting any infection, whether it is tuberculosis or any respiratory infection like corona. So they have to keep their blood glucose under control. And if the patient is having very good control of glucose, diabetic patients don't have to worry that they will get corona. They have more chances of getting it more. So keep your sugars under control. You are like a normal, healthy person.
I would like to add one thing to Dr. Ashish comment that the risk of getting corona is equal for each and every one of us. It is the difference in the complications. Because of the immunocompromised status, the patients with uncontrolled diabetes, they will be at high risk of complications. And to add this, I would like to request all the physicians and diabetologists who have joined us in this meeting that it is equally important to educate our patients regarding the vaccination. There is no vaccine against corona, but at least we can vaccinate our patients with diabetes against flu. We can vaccinate them against pneumococcal disease. So at least we can minimize the comorbidities. So it is very, very important to have your vaccination complete in this time so that we are at least able to get rid of those infections for those vaccine is already available.
Yeah, I think very well point, Ashish and Amit, especially about the vaccines. Because I think we are seeing that the deaths are more because of the secondary complications, as you rightly said. It has nothing to do with corona. And then as I think Dr. Amit clearly hit the target that it is the risk of uncontrolled sugars. And then there was a study also which has been done and it is published that those with A1C of less than 7.5 had a lesser incidence of complications, which you would definitely expect with somebody who is having it more than 7.5. So rightly said, and I think do we have any more questions? I think that I could see only this many questions. Or do we have any questions? Organizers, do we have any more questions? So I think if we do not have any questions, one line from each of you to close it. So from Ashish, what is your take-home message?
Take-home message, don't panic. Stay safe by keeping the distance, by masking and by sanitizing. You can keep yourself away from corona. So I am the live example. I have seen the patient in my clinic and he came positive. So be cautious at your clinics. Please wear the mask, N95 mask and the shield. That is very important. And keep your gloves and sanitizer always on. And please be safe and in your clinics, because now the more and more patients are coming. So you have to be cautious. In this 2 months period, we will have more patients. So for diabetes, many things.
I think, Amit, there is one question which has come out, probably you can answer this. So it says, what is your advice on national recommendations for telemedicine in a vast country, especially because of the high proportion of our patients are not appropriate for this technology? Your views?
It is not like that. What I feel is that telemedicine has always been there. But before that, the domain was restricted and it was being used for limited purposes, right? For many years, since WhatsApp is there, patients have been consulting us. They have been texting us, they have been sending the WhatsApp message. Only thing is that it was not a accepted way of communication. But now the new guidelines have accepted that it is also an accepted means of communication. And one of the important thing is that in India, many of the people, they are very well used to social media, right? So all these people are very well used to social media. So many of them, they know how to use it. So the technology, I don't think it is a major problem, because everyone around us is using these tools like Facebook, WhatsApp, messengers. So many of the people, they are well educated to use these tools. So that is not a challenge. Only thing is that we have to be aware of the local guidelines as well, and the district guidelines which are there for practicing in current time, because they keep changing. So you have to be you have to refresh yourself about the prevailing guidelines in your setup as well. So guidelines for Hyderabad may be different from what are there in New Delhi, and it may be different from Jabalpur. So we have to look into that aspect also.
There's one more question. I'm not sure if you want to answer this, but I think it's again to you, Dr. Amit. Which brand of blood pressure do you recommend? which machine which you recommend?
It is not about recommending a brand. Most of the tools, if you find that, you will find that these are FDA approved, these are validated. So any instrument which is validated is as good as anything else. Sometimes they may have some additional features which may not be required at all. For example, you may not like to store hundreds of readings. So if you want to store data of 3 months, then sometimes the instrument, because of the memory, may become expensive. Sometimes if you simply note down on a piece of paper, sometimes if you have a Bluetooth in the instrument, then these are the things which may make them more attractive. But we are not concerned with that. We are more concerned with the ability of the instrument to check the blood pressure. So that may be there in even a cheaper one. So it is not that you have to buy a specific brand only to monitor your blood pressure.
Yeah, I think very well said. I think that is the best answer we could get. So how to create more awareness on COVID-19? I think does it need now?
I think everybody is very, very well educated. And right now, just today, I have seen a slide in which there was an information that more than 23,000 articles have already been published on COVID-19, and there is a risk of being drawn into these publications. So we have to filter out which publication is going to be useful and which is not going to be useful. So a lot of data is coming. We have to be very careful. Every day, the new publications, new research is coming, and the digital world is flooded, medical world is flooded with research on COVID.
Yeah, I think definitely. I mean, there's so much amount of debate and controversy which is revolving around.
Just saw the MD medical exam paper today, and there were 10 questions, and all the 10 questions were on COVID-19.
That was expected. Oh, that was so. Amit, your take-home message.
My take-home message is that we have to keep ourselves regularly refreshed with the knowledge which has been any guidelines which comes from time to time from the government of India as well as the ICMR. And right now for us, the HCQS prophylaxis is there in the guidelines. So if you are at risk and seeing COVID patients, then I believe that we have to follow the ICMR guidelines. We don't have any reason not to believe them. And we have to wait for more data when it comes. So we can safely practice in our clinics as well as we can see the patients digitally as well. So we have to adapt ourselves to both modes of communications.
Yeah, I think very valid, important point. With a lot of debate on HCQ, ICMR has strongly recommended that for healthcare professionals, yes, you can take it as a prophylactic drug. So what the recommendation says is you take 800 milligrams on the first day and then 400 milligram weekly once for 7 weeks. And in fact, now they said you can extend it further.
Yes.
Because still none of us know that whether it may be causing any harm. The incidence of arrhythmia is just around 1.6 to 1.8%. So do not be worried about the data which is coming on that. Stick to ICMR. And I think as Dr. Amit and Dr. Ashish has clearly said, stay safe, be healthy. And then, yes, we have to change the way we are looking at our patients, and artificial intelligence, digital platforms will definitely help us in changing the way we treat our patients. So thank you all for joining us. Thank you so much, Dr. Amit. Thank you so much, Dr. Ashish, for making this.
Thank you, Dr. Faraz Farista. Thank you.
And over to you, Mr. Avinash, for the last comment.
Yeah.
Thank you, Faraz, for moderating the session. And thank you, Amit.
Thank you, Ashish. Thank you.
अभी ऐसे ही मुलाकात होगी 6 महीने तो और.
Sir, good evening. I'll just thanks everybody, sir. I'm personally grateful to today's faculties and moderator, Dr. Ashish Dengra, sir. Because of Ashish sir help, we could do this webinar today. I'm also thankful to Dr. Amit Gupta, sir, and Dr. Faraz Farista, sir, for moderating today's session. It was a wonderful deliberation on COVID-19, post-COVID-19 challenges for our diabetic and hypertensive patients. It was indeed a treat to listen to them. I'm also thankful to all the doctors from all across the country who are part or who are the part of this webinar. My sincere gratitude and a big thank you from Team IPCA. Stay well, take care. Thank you so much. Thank you.
Thank you. Corona namaskar.
Thank you.
Thank you.
Thank you.
Yes.
Bye, Faraz. Bye, Amit.
Okay,
Bye. Bye.
Bye, Faraz. Bye. Bye, Avinash and
Bye.
everyone.
Bye, Ashish.
Bye. Bye.
Yeah.
Thank you, sir. Thank you
Thank you.
so much. Thanks a lot. Thanks a lot.